Hi, today we'll discuss on cardiac output and determinants of cardiac output, and we'll mainly focus on the regulation of heart rate. Cardiac output. Cardiac output is defined as the volume of blood pumped by each ventricle per minute. So mathematically, cardiac output is the product of heart rate and stroke volume. Heart rate is defined as the number of beats per minute, which is approximately 70 beats per minute, and stroke volume is defined as the volume of the blood pumped by each ventricle per beat, and it accounts for 70 ml per beat. So that the product of these two factors become 4900 ml per minute, which is approximately 5 liters per minute. So left ventricle pump 5 liters per minute of blood to the systemic circulation, and then so systemic blood flow is 5 liters, and that reaches the right heart, and then right ventricle also pump that same 5 liters of blood per minute to the pulmonary circuit. Determinants of cardiac output. So cardiac output is regulated by two factors. One is heart rate and then stroke volume. We'll talk on details on heart rate, while stroke volume regulation will be talked in the next video. So stroke volume is dependent on preload myocardial contractility and afterload. Even the increase or decrease in heart rate also bring about the difference in stroke volume. So now let's talk about the control of heart rate. Heart rate, also known as chronotropic effect. Under physiological conditions, heart rate depends on rate of generation of action potentials by SA node. Now the factors which affect SA node firing are neuro, which is the main, and then other factors like hormones, temperature, metabolism, and stress on SA node. Now let's talk about the neural regulation of heart rate. Autonomic innervation, that is sympathetic and parasympathetic innervation of SA node, is the major means by which cardiac rate or heart rate is regulated. Parasympathetic nerve, that is vagus nerve, supply the SA node and AV node, while parasympathetic innervation to the ventricle is sparse. While sympathetic nerve also supplies SA node and AV node, and sympathetic nerve, there is a rich innervation of ventricular muscles by sympathetic nerve as well. So increase in heart rate is due to an increase in SA node firing, which is due to the increase in activity of sympathetic nerve to the heart, increase in plasma epinephrine hormone that is coming from adrenal medulla, and decrease in activity of parasympathetic nerve to the heart. This diagrams is the SA node action potential. So here there is a pacemaker potential, there is a depolarization, and there is a repolarization. So for the pacemaker potentials, what are the channel involved? The channel involved is HCN channel, through which sodium enters. HCN means hyperpolarization activated cyclic nucleotide gated channels. Another is transient calcium channels, through which calcium enters, and depolarization phase is after the threshold. Depolarization phase is due to the opening of long lasting calcium channels, in which there is a calcium enters after the opening, and then repolarization is due to the potassium efflux. So in the right side you can see the effects of sympathetic and parasympathetic on this SA node action potential. So A is the control of pacemaker potentials, B is the pacemaker potential during sympathetic stimulation, and C is the pacemaker potential during parasympathetic innervation. So you can see that sympathetic innervation, there is the increase in rate and rise of the pre-potential. It is mainly due to the norepinephrine secreted by sympathetic endings that acts on beta 1 adrenergic receptors present on SA node and AV node, that increases the cyclic AMP, which facilitates the opening of long-lasting calcium channels and thereby increases the calcium current and results in rapidity of depolarization phase of the impulse. While C, parasympathetic innervation. So acetylcholine binds with the M2 muscarinic M2 receptors, causes opening of potassium channels, causing outward diffusion of potassium, which counters depolarizing mechanism of pacemaker potential. In addition, activation of M2 receptor decreases cyclic AMP, and this slows the opening of calcium channel that results in decrease in firing rate. Note that parasympathetic stimulation not only reduces the slope of pacemaker potential but also causes the membrane potential to be more negative before pacemaker potential begins. Vagus nerve is tonically activated to some degree, and acetylcholine keeps the resting cardiac rate slower than it would be, like 90 to 100 beats per minute in the absence of vagus nerve. Now, other factors that influencing the heart rate are hormones like catecholamines from the adrenal medulla, cortisol from the adrenal gland, and thyroxine from the thyroid gland. This all increases the heart rate with the increase in these hormones. Temperature. Increase in body temperature by 1 degree Fahrenheit increases the heart rate by 10 beats. Metabolism. Increase in metabolism increases the heart rate, and decrease in metabolism decreases the heart rate. And then stretch on SA node. So whenever there is an increase in blood flow to the atrium, especially right atrium, that is increase in venous return, this will bring about the increase in stretch on SA node, and this automatically increases the heart rate. It is also known as Bain-Bridge reflex. This ends our today's session on the regulation of heart rate, and in the next video we'll be talking about regulation of stroke volume. Thank you. Have a nice day.